One of the most frustrating areas for people who are trying to get into shape is the lower back and the love handles or the bra rolls. These are notorious and they don't respond well to exercise and dieting and a healthy lifestyle. So, how do we go from this lower back to this lower back? The thing that can make this difference is liposuction, a fantastic tool, as long as you understand the limitations. And what are the limitations? The width of the pelvis is something you're born with, and that unless you've got a narrow pelvis, you will not really get this classical V shape if you have a broad pelvis. So that is one of the limitations. Of course, when we take out this fat, it is a very dense fibrotic fat, and therefore you can expect to feel much more discomfort after the surgery compared to, say, if you were having the tummy done, and the results take slightly longer to manifest. It doesn't matter what weight you are. You might be at your ideal body weight, and yet you might have these love handles. And once again, the best technique is to do liposuction either as micro-air assisted power assisted liposuction or for body tight liposuction. Which one of them you need is really determined on the basis of the skin laxity you have. In most patients under the age of 40, micro-air power assisted liposuction is the way to go. Once again, contrast this with the earlier slide, which was a patient with a narrow pelvis. This one has a broad pelvis, and while the patient has lost a lower back fat, there still isn't that V shape that you would want. Same, a lot of fat has been taken out from this young lad, and then he is much better off when he tucks his shirt in. It doesn't become a muffin top kind of appearance over the belt. So this one is just liposuction. This is a bodybuilder, and he has tried everything in the book to try to naturally get rid of these little deposits of fat, but till he has the liposuction, he cannot really get into that V shape. So the V shape, once again, to repeat, is a contribution of how good your latissimus dorsi muscle is, how narrow your pelvis is. The same rule applies for women. Now, this is a young lady who's had the liposuction for the bra rolls, another very resistant area, and also for the lower back or love handles. And we ask her to go side to side, and you can see that while the bra roll was that bad, when she now leans into the side, it is not as bad. And similarly, there is no fullness as was before the surgery. The incisions for the liposuction are generally hidden and not very apparent. In this patient, it might be that we went there, and the one for the bra roll is covered by the brassiere strap. This is a very slim lady, ideal BMI, can't lose the lower back, doesn't really get a nice shape to the waist until we go in and do a micro-air assisted liposuction. This is her from the side. You can start seeing how by selectively taking fat out from the lower back in the middle, you can get this nice scooped out appearance to the waist, enhancing the appearance of the buttock. Another patient, now this patient we've done the liposuction for the bra rolls, taken the weight off from the bra rolls, therefore she gets less of a groove. It also helps that the patient has gone and lost a fair bit of weight, which works with the liposuction, so the liposuction kind of gets them motivated to do something more, and you get a really nice smooth finish. So if you're affected by these issues, we would love to help you. Do get in touch with me, and my reception will arrange to see you as soon as we can. Bye for now.